All right. Well, good evening, everybody, and welcome. We're really excited to have you here tonight. First and foremost, happy National Disability Employment Awareness Month. I don't know if people are aware that October is the National Disability Employment Awareness Month. And so it is only fitting, if that is the case, that we talk about employment. And so we're really excited to have two guests from the Massachusetts Rehabilitation Commission come and talk with us about this very topic. But before we get started, I wanted to just introduce myself. My name is Elizabeth Bostic, and I'm here to kind of moderate our this evening's Connecting Family session, which is being hosted by the Federation for Children with Special Needs. So we're really excited to have this topic here. We will have a link put into the chat for anybody who is in need of interpretation services. So just know that that will be available to you. And our two speakers will, of course, do their presentation tonight, and then we'll have an opportunity for questions and answers after their presentations. So please put your questions in the Q&A or in the chat if the chat is available. So that we can monitor that and see what kinds of questions we might be able to answer before the end of this evening's session. All right, so let me introduce to you our two speakers. First one is Kathleen Kelly, who is the Student Benefits Counselor at MRC. She has over 35 years of experience working for human service organizations, developing programs that become models for success. She is currently working with the Mass Rehabilitation Commission as the Student Benefits Counselor for transition age youth and their families. She has assisted schools with the development of their transition programs and advised service providers on best practices when working with transition age students. Her passion is to ensure that everyone has equal access to a successful outcome. So please join me in welcoming Kathleen. And also with her is Reyes, who is the West District Director of the Vocational Rehabilitation Division of the Massachusetts Rehabilitation Commission. That's a lot in one mouthful right there. So Rachel, being the Western District Director for MRC, she has been with MRC for 7 years and has worked in the nonprofit community supporting families and youth with disabilities for over 30 years. She serves as the Pre-ETS lead for MRC and is the Department of Developmental Services liaison, ensuring collaboration between those two agencies. So please join me in welcoming both Rachel and Kathleen. All right, so I think we're ready to get started. And I think, Rachel, are you up first?
I am. I'm up first. So let me share my screen, hopefully the correct screen. Here we go. Just making sure. Can people see my PowerPoint?
Yes.
Okay.
Yes, we can.
Fantastic. So as Liz said, my name is Rachel Reyes. I'm the West District Director for MRC. And I am the person that is pointed to Pre-ETS for our agency. I, in my previous life in the private sector, I had operated a number of programs supporting transition age youth, including Pre-ETS or its earlier iteration, Youth Works, and a number of community block grants. So this is very near and dear to my heart. So I'm excited to be here talking about it. And I'm kind of going to talk about Pre-ETS as a service that MRC provides and the transition to employment services through our VOC Rehab division, so Vocational Rehabilitation Division. So moving on, if this will let me do that, just a little bit about us. Just a little bit about MRC. We envision a commonwealth that is open to all, where everyone can seize their true potential and contribute fully to our communities and the world. We work together to break down barriers and make the state a better state possible for people with disabilities, one that is truly equitable, accessible, and inclusive. So Pre-ETS, what is Pre-ETS? It's a bunch of letters, right? Well, Pre-ETS is Pre-Employment Transition Services, and it is a program that MRC provides across this Commonwealth where we serve students ages 14 through 21, right up to the 22nd birthday, we provide the opportunity to experience and explore the world of work. And we do this in partnership with 40 or so community providers. So students receive services across the state from providers that are connected to school districts. So we have every public school in Massachusetts has a Pre-ETS provider assigned to it and an MRC counselor assigned to it. The Pre-ETS providers also can serve students in community and state colleges, homeschooled, charter schools, private schools, specialty schools, schools especially identified for students with special needs. So we have providers across the state that are partnering to bring Pre-ETS to students. We've created this program to really help students think about careers, not when they're about to graduate, not 2 years prior to graduating, as young as 14 years old, to start thinking about what you might want to do in your life. What would be interesting? What are you interested in now? What would you maybe want to consider as a career? So it's a really great program, and it offers all kinds of opportunities for students. This PowerPoint is going out to everybody afterwards, correct? My Federation friends? Yes. Yes, my Federation friends say yes. That way I don't have to read it to you verbatim. The Pre-ETS program, so as I said, we provide funding for 40 providers across the state to provide Pre-ETS to students. MRC also provides funding for each Pre-ETS providers to purchase technology. They all have lending libraries. They use different software from what used to be called Virtual Job Shadow, which is now called Pathful Explore. We have some providers that use virtual reality software. Honestly, anything that keeps young people interested in thinking about work. And we found that technology actually helps. Each school has a provider assigned to them. A lot of schools are letting the providers come in, partner with the teachers, run classes in schools. Some of the providers offer things in their own, in community centers or their own agency, the local town hall, or after school sessions. So it's a neat opportunity for students. So there's 5 components to the Pre-ETS program, and these are all mandated by the Workforce Innovation and Opportunity Act. The first one is job exploration counseling. I love this young woman. She's really contemplating what she wants to do when she grows up. Work readiness training, really getting prepared for a job site. What do you need to know about, to be successful on the job? Work-based learning experiences. These can be paid or unpaid work experiences, such as internships, job shadows, tours of employer sites, having an employer do an informational interview or presentation for students. Really great way to learn about different types of work you might not even know existed. Counseling on post-secondary education and training. Yes, high schools are supposed to do this, but we all know it's not entirely equitable. What one guidance counselor might be doing for a student that doesn't have special needs might look very different for a student with special needs. Our providers, as well as our counselors, want students to think about all kinds of opportunities. Not everybody has to go to college, and not everybody has to go to a trade, and not everybody has to go to work immediately. Some people need to experience things differently. So we like our vendors to really spend some time with students thinking about, what do you need for training potentially after school? Do you need training? Do you want to go on to something better? Is college in the cards for you? Is it not in the cards? What can we do to help you? So this is an important piece of the Pre-ETS program. Self-advocacy. This is another core component to Pre-ETS, and there is a lot of work that needs to happen with young folks with or without disabilities to learn to speak up for themselves appropriately, ask appropriate questions on the job site or the internship site, maybe tell that guidance counselor that they really don't want to go to a 4-year college. They're interested in being a truck driver instead. All of those things take self-advocacy skills. Telling mom that it's okay that they stay up an hour later. They'll be okay the next morning. That takes self-advocacy skills. We all have them. It's really important for students to start using them when they're young and using them appropriately. So what can students expect related to pre-ETS? Usually from 14 to 16-year-olds, it's really about exposing students to what they might like to be thinking about for work. Definitely working on self-advocacy, exploring a bunch of different work opportunities. Sometimes all students think about is what they know around them, places they visited, what their parents or siblings or friends do. They really have a limited scope of understanding all the amazing opportunities for employment in this country. This can all happen prior to MRC eligibility. So this is an important piece. Students 14 to 16 are typically not made eligible for MRC, but our providers can provide these services. So this is a critical piece for folks to understand. You don't have to come in and become an eligible MRC client to get pre-ETS services from our providers in partnership with the schools. Around 16 and up, the providers really start working on developing skills for a career, soft skills, a little bit more concrete skills, really exploring education, job training opportunities. This is a great time to do internships. We've had a lot of students doing summer internships or after school internships, and it's quite successful and very motivating for the students. Then after high school, we can provide, as I said, pre-ETS services to people that are not in traditional high schools. They can be homeschooled, they can be in specialty programs, and we can provide services for students right up till 22 if they're in a community or state college. So it's a neat add-on. Our providers are partnering with the state and community colleges across the state. So this is another opportunity for students. If the student is not in school, or I'm sorry, if a young person is not in school, then they're not eligible for pre-ETS. This is very specifically directed for students. So just to be clear, if there's a young person who's 17, left school, needs some help getting ready for work, the appropriate thing would be a mass rehab referral, not pre-ETS, because pre-ETS is specifically by the law required for students only. And then thinking about life after high school, part of what the pre-ETS providers do and with the students is help people think about when they leave school. There's some things that families need to really, really know. At least 2 years prior to graduation, if a student is going to need supports to be successful in the world of work, that's when to apply to MRC for services through our vocational rehabilitation counselors. I have the information up on the screen now, and it'll come out in PowerPoint. We have one point of entry now for mass rehab across the state. It's called MRC Connect. It is a group of screeners that do eligibility screening for consumers. We have employed what we call the California model, which is a light touch eligibility, meaning that you as a parent do not need to carry your giant binder full of IEPs and every testing that the person has ever had to get in the door at MRC. We will accept minimal documentation. We will even accept, for some folks, self-attestation that they self-identify that they have a disability. So the process is moving along pretty well. MRC Connect is a new program, so all the bugs aren't worked out, but our goal is that everyone will come through the front door in 30 days or under. We're not quite there yet, but that's our goal. The other way to get long-term services or services after graduation is really on your school system, and it's called the 688 process. And the 688 referral is a law. 688 law, chapter 688 requires schools to refer students who will likely need substantial support to work more than 20 hours a week to the 688 process. And this is very arbitrary because schools have to sort of guess, right? Somebody's 15, 16 years old. They're not entirely sure how much support they're going to need when they're 22 and graduating, but they still need to complete the 688 process if they think the student's going to need support after graduation. And it's vital that they do, because some of our sister agencies, both DDS, Department of Developmental Services, and DMH, Department of Mental Health, receive funding specifically from the legislature based on the 688 referrals they are going to have turning 22. So if your school's like, I don't know if we need to do a 688, just call Mass Rehab directly. If you think your student is going to need some level of ongoing support after graduation, make sure the schools are completing the 688 process. Students can also apply directly to MRC for services and not wait for the 688 process to be cleared. So the school's doing the 688, that's great, especially if you think your student is going to need to be served by Department of Developmental Services or Department of Mental Health. You want that 688 on the books, but students can work directly with MRC without the 688. Anyone can apply to MRC services on behalf of the student. It can be the school, it can be the parent, it can be the student, it can be a sibling, it can be the pastor of your church, it can be somebody that's partnering to help advocate for the student with the student's knowledge. So it's a pretty open eligibility door. So how does MRC Connect work? We gather the information, whatever is submitted. It is an online portal. You can upload documents. Like I said, we don't need 1 million documents. You can call the 1-800 or the 617 number. And then they do screening for a number of the departments at MRC, the vocal rehab department, the work department, that's me, statewide head injury, home care assistance, and supported living. And that's not shared living through Department of Developmental Services. It's specifically a supported living for folks that don't have other services like DDS. So MRC Connect screens people for all those different parts of our agency and sends it to the right place. So VR, folk rehab, that's who I represent. We are the division of MRC that helps people go to work, and not just go to work. Our goal is to help people have careers and have careers in this modern workforce. So we partner with public colleges and universities. We partner with tons and tons of training institutes all across the state and sometimes out of state for specialty services. We partner with employers all over the state and actually some all over the country to match people with disabilities with a career or a career path that works for them. And we personally run a lot of different opportunities for folks through our job-driven training program, which is programs that MRC contracts with for high-need labor markets. For example, we've been running a cybersecurity program in a couple of Holyoke Community College and Roxbury Community College because there's not enough people entering that career field. So we do partner with workforce and labor around getting people trained in programs that we know that there's employment available. So this is a little bit of a list of the things that we offer: counseling and guidance. We can do interest testing and aptitude testing. We can do diagnostic testing if somebody really needs it. Maybe they didn't get good testing from school and they're still really struggling. We can enlist that. We have job placement services. We have a group of over 53 provider agencies that provide employment services as well as our own job placement staff. As I mentioned, we have job-driven trainings. We partner with colleges and different vocational programs. We can provide assistive technology while schools provide it while students are in school. When you're going to the workplace, you might need something totally different. We have a whole assistive technology department that refers folks to agencies and helps people identify what items folks need to be successful. We have financial wellness, benefits counseling. My colleague Kathy is going to be talking about that shortly. Our Pre-ETS program, obviously, school to work counseling, employer consultation. We do a lot of ADA work with American with Disabilities, work with employers, just making sure that things are accessible for people that we're placing. We have sign language interpreters. We have bilingual staff. We can contract with interpreters and translations assistants. So we really try to meet everybody's needs as best as possible. So what can we help do for you? We can help your students prepare for careers. They can have that assistance partnered with a Pre-ETS provider before they apply for MRC services. They can have it from our counselors once they do apply for MRC services, and you can have Pre-ETS and work with a counselor at the same time. And you can be a DDS consumer and work with Pre-ETS and work with a counselor at the same time. And in fact, we have some students that are served by DDS, DMH, Department of Mental Health, Department of Developmental Services, Mass Rehab Commission, and a Pre-ETS provider. I know that sounds confusing, but it's just, sometimes it takes a village, right? Sometimes it takes a village to support people. So that is what we do. None of these programs are exclusive. They can overlap and commingle. Our counselors are all trained right now, master's level clinicians that know rehabilitation counseling. Their job and their passion is to help people go to work. And we collaborate with all state agencies, like I mentioned. So it's really, we have a lot of opportunities for students transitioning into adult services or just transitioning into work. And I put the question slide up there because Renee was nice enough to send me a few questions ahead of time. And a few are for Kathleen. But here's one. Can my young adult work more and keep, oh no, this is Kathleen. Kathleen, you got half of these questions. I'm gonna leave those for you. Let's see, how can I help him get a job in the future? Transition program is not helping a lot. Well, I would suggest that if there's a student that hasn't been connected to Pre-ETS yet, that you would want to reach out to the school and ask why your son or daughter has not been referred to Pre-ETS. And if your student is within 2 years of graduation, I would recommend contacting your local MRC office to have a conversation and applying for services through MRC Connect. Don't wait for the school to do the referral 3 months before your son or daughter graduates. It literally happens all the time, and it's a great disservice to students. We need to get students connected with Pre-ETS providers early, and they need to get connected to MRC a couple of years prior to graduation. How can we get started with Pre-ETS supports? Are there volunteer and internship opportunities for 15-year-olds, soon to be 16, on the North Shore? Who is a good contact for knowing which employers are experienced with working with teens with disabilities? I don't have an answer to that last question, and the North Shore is not my catchment area. But again, if you want somebody to be connected to Pre-ETS supports, you can ask the school to do a referral. You can call your local MRC office, and if you say North Shore, I'm guessing Salem, you can call the Salem office and talk to the unit supervisor, ask about the Pre-ETS providers, mention what you're interested in. They also know their local employers. So it's ideal to connect with the MRC office. We all answer calls all the time with just sharing information, like no strings attached. You can call to say, I have some questions about Pre-ETS. Can I talk to the unit supervisor? If you call Salem, I'd ask for Paula. If you are from Salem. We're just guessing here for the North Shore. How do I know if my child will qualify for work through MRC, and how do I get them set up with job coaching outside of school-related internships now? I can be, and I hate to burst your bubble, but I do want to tell you that Pre-ETS doesn't, the funding we have for Pre-ETS does not provide one-to-one job coaching for folks. It's not intended to. The funds that we have from the federal government are not intended to provide that. So if somebody's getting job coaching and needs intensive job coaching through their school program now, in all likelihood, Pre-ETS would be working on all those other core areas because they do not have the funding for staffing one-to-one job coaching. Now, they'll go into a job site when we're setting a student up for an internship, get the student up and running, maybe spend a day and another half day there, spend some time checking in on folks, but it is not a one-to-one coaching model at all. It's really meant to show students all kinds of opportunities. However, just because a student may need a lot of job coaching and is working with the school with a lot of job coaching, it doesn't mean that they're not going to benefit from all the other parts of Pre-ETS, right? So some of the other things that we work on, self-advocacy, thinking about post-secondary training, work readiness skills, those can all be provided by the Pre-ETS provider, but they're not able to provide one-to-one job coaching. Whether your child will qualify for work with MRC, if you're talking about after graduation, will they qualify? If you are a person with disability, you want to go to work and you can benefit from voc rehab services, you will be made eligible if you follow through with MRC Connect. The question really is how much support does somebody need? If somebody as an adult is going to need one-to-one job coaching all the time, we would defer back to Department of Developmental Services, because that is not how our funding structure works. At Mass Rehab, our goal is competitive employment. And if somebody we work with has been placed competitively, we typically close the case after 90 days. We can provide some ongoing supports through our vendor community, and we do that all the time. But our role really is to move people into employment and help them become independent. In what order should we sign up for things? This is a Social Security question. I'll give that to you, Kathleen. Jobs for both my older girls who have significant and learning and emotional disabilities. How do they survive in this world when we are gone? That is every parent's fear. And even those of us that do not have children with disabilities, what's going to happen? It's about building that village, whether the village is a service provider like Department of Developmental Services that serves people long-term, a good relationship with an MRC counselor, because once we close your case, if you have a job, you can always come back. There's no like, you take a ticket and you wait 3 years, you can come back again because you've passed your time. People come back when they need us. They come back and they come back again. And many people come back many times. It's not a one-shot deal at MRC. It's about also building natural supports, finding that employment site where the front end supervisor is super accepting, where the manager also has a family member with a disability and is more kind about repeating directions multiple times. It's really about building the village, and our counselors like to partner with families around that, but some of it's about where are you? Where's your network? Where's your social network? And it's important that we find those natural supports in employment settings. Jobs for nonverbal individuals with significant intellectual and visual impairments, age 21. So I should be clear, if the visual impairment is such that a student is legally blind or blind, voc rehab services typically run through Mass Commission for the Blind. In Massachusetts, there's VR Mass Rehab for all disabilities other than people that are legally blind or blind. And yes, there are definitely jobs for folks of all abilities. It is a question whether MRC is the best provider or whether it's DDS or we're blending services and braiding services together. Lots of folks get services by DDS and come to us for like help finding that job match, but DDS is committing to some of the longer term supports to keep the person stable, safe, and working. So reach out to service coordinator, reach out to the local office, have those conversations about the fact that your student probably is going to need some braided services. What supports are offered for students who want to attend college? Are there summer programs to help identify or try different career paths? Yes, Pre-ETS does that. All of our vendors run year-round summer as well. I recommend making sure the referral happens before the schools close because it's a great way to meet with students when the schools are open, with the guidance counselor or SPED teacher. What supports are offered for students who want to attend college? Our counselors do this every day. Tons of students come to us who want to attend college. MRC, it does have a financial needs requirement. So if families don't meet our financial need criteria, we may not be able to pay for college. The vast majority of people who come to MRC, we are able to assist them with paying for college. Always apply for FAFSA. Whether or not you think you will get it, always apply because you never know. Sometimes we can pay a portion. Our threshold can be higher than FAFSA, and FAFSA looks at parents through age 24 for the student. Even if they're on SSI or SSDI, any student that's on SSI or SSDI automatically meets our financial need for VR services. So there's some nuances to that. So I tell families, always apply for FAFSA, even if you don't think you're going to get it. Absolutely. Students that are on SSI or SSDI automatically meet our financial need threshold for VR services. That allows us to help pay for colleges. Even if we can't pay for colleges, we can spend time with that student really thinking about, what are you going to college for? What do you want to do? If you're anything like my kid, you change your major 4 times and make your parents crazy. That's normal life, as painful as it is for us parents and sometimes our counselors. But we're there to support students really thinking about it. What do you want out of college? It's not just about the college experience. Would someone be disqualified for getting supports from MRC? Typically, no, we don't. If you're disabled, you want to go to work and you can benefit from VR, you basically are made eligible for VR. If somebody might not make it through eligibility if they don't follow through with the calls from the eligibility screeners, don't complete meetings, just generally don't participate. So we might close a case, but people don't typically get disqualified. The only one qualification though is you do have to be legal to work in Massachusetts. So it's possible that somebody who is an immigrant status would not be eligible at this time until they got working papers. And would the person receive supports to run their own business? We actually do a lot of work related to supporting folks with self-employment plans. All of the offices do that. We typically partner with SCORE, which is a group of retired business folks that help folks work plans, or various small business development agencies or small business incubators. But helping people run their own businesses is very often what we do. We do need to navigate people through the process of writing a business plan, creating a budget, determining their market, et cetera, before we can put funds in place. But yeah, it's something we do a lot. Those are my questions, and I've eaten up my time, and I think I need to turn it over to Kathleen and stick around if there's any questions for the two of us at the end. Okay. So let me unshare on one of my many screens and turn it over to Kathleen.
Hi, everyone. Can you see my screen okay?
Yes.
Let me just check if it will move. It's not moving though. Hold on. The only thing is it's not advancing. If anyone can help me.
Try clicking directly on the screen and then doing it.
There you go. Great. Thank you, everyone. So yes, I'm Kathleen Kelly. I work at Project Impact at Massachusetts Rehabilitation Commission. And the focus of my presentation is how work or earned income could impact Social Security benefits that your sons and daughters may be receiving. And as a student benefits counselor, there are 3 of us across the state. So I cover the Northeast area. We have one down in Boston South, and then another one out in Western Massachusetts. So we're all trained specifically to work with students. And we provide in-depth personal benefits analysis. So really looking at the personal situation. Everyone receiving benefits is an individual, and they receive benefits based on their circumstances. So it's very individualized. And so what we'll do is we'll learn about the benefits you have, maybe counsel you on perhaps some different benefits or more benefits you could receive. And then we can also assist you with resolving problems related to benefits. Unfortunately, there's a lot of those, especially if you don't work with the benefits counselor, so that they can help you manage, your benefits better. And the nice thing is we can come meet you in your community or at the school that your son or daughter is attending to make it more convenient for you. And also we meet virtually now, which everybody's doing. So I'm going to talk about the 2 benefits that the Social Security Administration manages for your sons and daughters. The first one is Title II Social Security, and this is actually real Social Security. We call it under acronyms. You may have heard SSDI, CDB, DWB. Basically, it's Social Security disability benefits. And this benefit comes with Medicare after the eligible person has been on the benefit for 24 months. The one that we're mostly helping students with is Title 16, which is actually not Social Security. It's actually the Department of the Treasury and its welfare. And this is called Supplemental Security Income, or SSI. So it can be misleading because of the security word there. And this benefit includes Mass Health Standard. And I'm going to dig into the weeds here. So Social Security Disability Insurance, SSDI, is a benefit that your son or daughter would only be receiving this based on someone else's work record. Remember, I'm working with people, or we're talking about people 18 to 22. And typically, that doesn't mean it never happens, someone between 18 and 22 hasn't earned enough credits to be receiving SSDI, but they can receive it through their parents, either because the parents unfortunately are deceased, disabled, or retiring. And so the payment amount is based on the number of credits that the parent or the person with the work record has earned. The nice thing about Social Security disability insurance is there's no resource test or asset limit as with SSI. And then you're eligible again for Medicare after 24 months. That's just the basics of SSDI. We're going to really be seeing more, talking more about students who are receiving Supplemental Security Income, or SSI. And this is a low-income program that provides assistance to disabled, aged, and blind who have limited income and resources. So basically poor in the eyes of the government. And with that, your asset limit is limited to $2,000 for an individual. And if someone is married, it's $3,000. So that's pretty poor, right? And again, they're automatically eligible when they become eligible for Social Security, SSI, for the Mass Health. And then the payment amount that you're going to receive, or your son or daughter will receive, is based on their living arrangement. And I'm going to go over that. But again, it's paid through the Department of Treasury, not Social Security. And this is how Social Security, managing this benefit, will look at how much of a benefit they're going to give you. So the first category in their eyes is actually category A, and that's a person who's living independently. And we really never see this with kids still in school, 18 to 22. This is living on their own in their own apartment, paying for all their expenses. There's no one providing in-kind supports. And those are the benefits that they receive, $914 in the federal benefit rate for SSI. And then we live in a state, Massachusetts is a pretty expensive state to live in. So our state government has developed the state supplement program. So you get another check, you get a second check from the state. And in this case, it's $114.39. So basically, you know, more commonly, we're talking about the next two living arrangements. So shared roommate, residential program, and even living in the home of a parent. And to be eligible for this rate, if they're living in a home of a parent, they have to be able to demonstrate that they're paying their fair share of household expenses. And that's a bit complicated to explain in this presentation, but I would ask that you reach out to me if you would like a little more information on that. With that, the state supplements $30.40. Most cases I'm dealing with when kids are still in school is in category 3, which is the household of another parent. So what the government does, or the Department of Treasury, is they take 1/3 off of the $914, and it's $609.34. Again, because they didn't demonstrate in the application process that they are paying their fair share. And they give them a little bit more in the state supplement. Okay. Primarily, this presentation is going to talk about how you can work and still get benefits. When your son or daughter becomes ready, or is already ready to begin working, you're going to hear from a lot of parents and maybe people who have misinformation, and they may say to you, oh, your son or daughter shouldn't work, they'll lose their benefits. And you know what? They'll lose their health insurance. And that's simply not true. Social Security wants young people to work in high school because there's evidence, strong evidence, that if they work, they'll be better prepared for life. And they like that idea. And also there is a program under the Social Security law that protects their mass health. And I'll talk about that. So again, Social Security wants students working. So this is the best time, in fact, it's the best time, right, to go out and work when you're still in high school, especially between 18 and 22. And Social Security has these wonderful work incentives. The first one I'm going to talk about is the student earned income exclusion. And that is a benefit that's an incentive that's available for students under age 22 who are still in school. And to qualify for this, they have to be either still in school in high school. And this includes folks that are maybe attending school, public school from their home because of medical reasons or other reasons. But they have to demonstrate about 12 hours a week of attendance in their school. They could be enrolled in college or university. They could be in a skills training program like Job Corps that's post-high school. It's wonderful because they allow students to really make as much as they want. And when I say as much as they want, it's up to $2,220 a month, which is an amazing amount of money for a young student focusing still on school and job development. So I don't worry too much when students are working when they're in high school and receiving this incentive. The maximum exclusion is about $8,950. Now, these numbers I'm giving you tonight are for 2023. It's a very fluid situation with Social Security, so I'm going to caution you to not, if you were to look at this slideshow next year, these numbers would look a lot different. And lastly, about this student earned income exclusion, it's not automatic. So you have to let your Social Security local office know that your student is still enrolled, or your son or daughter is still enrolled in school post 18. Otherwise, they automatically have a button. And as soon as they turn 18, they assume they graduated high school. So it's your responsibility to get a letter from the school, and most schools are very used to doing this, and ask them to just put the, on their letterhead, the date that they expect to graduate and submit it to Social Security. Okay. Again, after age 22, they're no longer eligible for this benefit. So what Social Security will do, because it's a means tested benefit, is they will reduce some of the Social Security based on earned income, but it's not dollar for dollar. So I'm giving you a pretty easy example here and we're using John, who has earned $885 gross income in, let's say, the month of January. And I say gross income because that's what you're going to be reporting to Social Security when you begin to report their income. And so we have John's $885 of gross earning. Social Security has this, they first don't count the first $85 because of this earned income exclusion they have. And then again, then they'll take, they only count half after that. So they took $85 off, he's down to $800. They took another $400 off. So they're only going to count $400 of John's countable income. So they'll take that off the total amount he's receiving. So if he's receiving that category A, he'll still receive his gross income, and his new SSI payment is $628. So if you look to the right, when John works, he's going to earn more money. So it's right here in black and white and green. There's another incentive that they have, and it's called the employment-related work expense. You can be eligible for this impairment if you have these out-of-pocket expenses that insurance doesn't cover. And there's so many of them, I can't even mention them all, but some might include medical devices or support animals or a special diet. Someone that PCA, personal care, transportation. This is a great one. If you are, as a parent, or if your son or daughter isn't on a public transportation or fixed route, you can count the travel expense, the gas in the car, and or an Uber as an IRWE. And I'm going to go back a slide because that will come off here in this equation. So we'll figure out together. There's an application process. We'll figure out what that IRWE is going to count as, and I'll help you get that written off the countable income. I mentioned that your insurance is protected through the Social Security Act. There's a section called 1619B, and that allows a recipient, if they reach the break-even point, so going back here, if they earn so much that their check went down to zero, they would still be eligible for their Mass Health. They would keep that Mass Health as long as they are earning in 2023 under $45,000. That's a lot of money. They also have to remain below the asset test limit and then remain eligible for Mass Health, which is never a problem. So this is a wonderful thing to know because by and large, I meet parents who are most afraid of losing the Mass Health, the health insurance, especially if it's primary. So reporting to Social Security is a large part of my job. A lot of parents need help and support in understanding the paperwork you're receiving and what do I report to Social Security so I don't get into trouble. So here's nuts and bolts here. Whenever you're starting or ending a job, any change in the work income, any change in child support with young people 18 to 22 is a big issue because they count that child support against the cash benefit. Lottery winnings, change in a living situation, address, or hospitalization. So these are things you have to notify Social Security about. You also have to report your income monthly at the beginning of each month if you're on SSI and SSDI. You have to, what I usually suggest is you can report your income through the telephone wage reporting system. That's a phone number. They also have a mobile reporting app that you can get on the App Store. You can report some of your your income for SSDI online. I do strongly advise the first few paychecks that you get, or at least the first paycheck, you bring personally down to the office and get a receipt. It seems to work best for everybody. Okay. And then because there's a challenge with the asset limit, ABLE accounts was an act, there was an ABLE Act passed in around 2014, which allows for families to save for their disabled children for their future without being having it count against the Social Security benefits they receive. This is a wonderful opportunity, and it's available nationwide. You don't have to just go with Fidelity in Massachusetts. I'm not an expert on this issue, but there are limits to what you can save. Currently, it's $16,000 a year, lifetime $100,000. There's some wonderful benefits to this, and if you want to email me after the slides or when you have some time, I can explain it a little further for you. Other things to think about if you're applying for Social Security at 18, which most families are doing, because applying at 18 avoids them counting parents' income. You know, if your parents are both working and you apply for your son or daughter before 18, they're going to count your income. So most wait till age 18. When they're 18, there's a lot to do. Guardianship, if you're considering that, applying for Social Security, but there's also some very important things to do. One of which is to, even if you're not certain, get your son or daughter on a housing voucher waiting list. Start to think about food stamps. If they're living with you at home, they'll be eligible pretty much automatically if they receive SSI at age 22. So these are things to think about to add to your checklist. And that's it for my slides. I looked at the questions yesterday afternoon when I received them, and most of the questions, if not all, answered your questions, I believe. This is my contact information. I try not to cover too much, and I do avoid asking for questions that are specific to someone's benefits. So if you have something specific or you just didn't get it all, please reach out to me. I'm available through email or on my phone to check in with you, talk more specifically about your benefits, or maybe even help you learn how to apply for them. So thank you.
All right. Thank you so much, Kathy, for all of that information. That was quite comprehensive, and it's always striking to me the level of detail you have to have in order to be able to execute all of these.
Oh yeah.
To access all of these wonderful benefits, right?
Yep.
So thank you for all of that. And of course, as everyone knows, we will be sharing the slides with everybody and the recording. Does anyone have any questions relative to benefits? I know there were a few in the chat relative to MRC and employment and accessing a few things. So I just want to double check and see before we go back to that, whether there's any questions around benefits. You're getting a lot of appreciation, both of you, for your presentations. So just know that it's happening in the chat.
Oh, thank you, everyone. It's my pleasure.
Happy to be here.
So some folks had some questions around whether or not they could actually apply to Pre-ETS directly and find providers directly. Is that possible?
Yes, absolutely. I will also send the most current list of providers that are assigned to the different school systems to Rebecca from the Federation that she can share with families as well. The schools should know who the Pre-ETS providers are, but a lot of times families contact offices directly, homeschool kids or out of district placements or whatnot. So as I said, providers are assigned to school, but that doesn't mean that that's your only option. Just say hypothetically, your student had already worked with a provider and you weren't 100% thrilled. You can always reach out to the MRC office to see if there's anybody else that has any availability, in their services to support your student. And especially if they're at a different type of school, like an out-of-district school.
Great. I have a person who's wondering if a student who was in an out-of-state placement in Massachusetts, but is a Massachusetts resident, but is in an out-of-state placement, can access the Pre-ETS services in Massachusetts. Do you collaborate with other vocational rehab services in other states?
That's actually an interesting question. It's because it's so different school to school, right? So some out-of-state school programs collaborate directly with their VR offices. So they have Pre-ETS providers or Pre-ETS services provided in that state. Then there are students that are placed out of district, but come home during the summer, and we've matched those students up with providers for the summertime. I would say that it would make probably the most sense to contact the supervisor at the local area of MRC office that's closest to you and have that conversation, because every state that we deal with has been very, very different.
Great. Yeah, that makes sense. It's the I in the IEP, right?
Right.
So
It's hard. And truth be told, some of the out-of-district schools that have a strong transition program, they do a really good job around transitioning students to work. So if you're, not to slight our providers, but our providers are light touch, like we're an add-on. Pre-ETS is an add-on to what schools already have to provide your students. They are supposed to be the primary source of transition services for your students. We're layering on some additional supports and some bigger picture thinking, but it is light touch. Pre-ETS is light touch. So if that school is like intensively working on transition services, it's probably honestly significantly more resources than you would get from a Pre-ETS provider.
And there's a question you may or may not be able to answer. As a family is wondering whether or not DDS can provide one-to-one on-the-job supports. I don't know if the two of you, I know they're sister agencies, so I don't know if you have any insights about that.
Yeah, sometimes they do, and that's part of the ISP, the individual service plan. It depends on the situation and the funding of DDS. So I do know of cases that is the case. Sometimes it's specifically because of significant medical, behavioral, or forensic issues. If it's if those are the issues, then there's more likelihood that funding would follow for individualized one-to-one services. But if it's a student that is more capable and maybe could have coaching initially, the goal for DDS, like our goal, is to eventually fade services so the student can be independent. So they're in it for a lot longer haul than we are. But yeah, I would definitely start having those conversations with the service coordinator early.
Okay, great. Well, I think that's about all we have for now, and we are very close to the top of the hour. So I want to thank you both, Rachel and Kathleen, for all of this incredibly comprehensive information. We will again provide the slides and the recording to everyone. And in the meantime, I know our executive director, Pam Nurse, wanted to say a few words before we closed out the night. Pam, are you able to, we can't hear you if you're speaking.
She said she can't unmute.
Oh, she can't unmute. Oh, that's really frustrating.
Let me see if I can unmute you.
Okay.
Pam, you're the executive director. You should have all power.
You should have all power, exactly. The host
Can
has to unmute.
Can I unmute you?
It worked. Yay.
Yay.
Oh, yes, even I cannot unmute Edna. Well, I want to give a very, very special thank you to Rachel and Kathleen. What an amazing amount of information you gave us in a very short period of time. Just really amazing. And thank you, and to you and all your colleagues for the work that you're doing to, help support our youth and young adults. And thank you to Beth, as always, for your wonderful facilitation for our Connecting Families programs. I wanted to call your attention to our upcoming Planning a Life conference that's taking place October 13th and 14th. I believe that Rebecca had put some information in the chat. It's for parents, caregivers, professionals that have and are working with transition age youth transitioning from secondary school ages 14 to 22nd. It is a really great conference, and we really encourage you to attend if possible. More information is on our website, and I do believe Rebecca put a link in there. So it is good to see everyone. Thank you all for joining us tonight. There's going to be an evaluation form that comes out at the end, and we really encourage you to please fill it out. We do read those, we use them, and join us for our next Connecting Families first Thursday in November. So thank you again for joining us.
Thank you.
Have a great evening, everybody.
great
Thanks for
night.
joining us. Bye-bye.